About the presentation regarding the vitrector and the sterilization. The next presentation is by Dr. MALLIKARJUN.
Dr. MALLIKARJUN HERALGI, he's from Sankarai Hospital, Shivamogga. He'll be speaking on setting up and using a standalone vitrectomy machine. Now, how do you set up and use this? So he's going to simplify for us and he's going to show us some video on that. Over to you, sir.
Thank you, Dr. Megho, and thank you, Dr. Marathi, for including me in this interesting IC. And mainly my topic is on standalone anti-vitrectomy, how to use it, and what are the troubleshooting, and also sterilization. I have added. There is a little bit overlap of the previous presentation also.
So can we have the audio for you?
Yeah. Vitreous cutters are based on the Galliton principle.
Okay, this is not changed.
When the vitreous gets engaged to the cutter, it gets into small pieces and makes aspiration easy. When you see inside, there is a spring which will be moved with the help of air pulse, and the blade will move to and fro. There are modifications of these cutters also where there is no spring, but there is the air pulse for the forward movement and backward movement of the cutter. This is the front view of the vitrectomy machine. It has a two digital display for cutting and aspiration, one knob for vitrectomy probe and other knob is for adjustment of the vacuum and electrical switch. The cost is much lesser than auto refractor. One can easily afford to buy this machine. This is the back side of the vitrector, air inlet, vacuum for foot pedal and electrical switch wire. And the air comes from the central compressed air outlet in our hospital, and also these machines will come with the small tiny compressors. This is a small bottle which helps to create vacuum by Venturi pump system. This is the cutter with two tubes. One is in blue color, other one is in white color. The blue is for cutter and white one is for vacuum. So one should not confuse when you are setting it. The vacuum outlet is connected to the vacuum bottle with a tube. The other end is connected to the vitrector vacuum tube. The cutter tube is connected to the vitrector console, blue to blue. The right side of the foot switch is for cutting and aspiration, left side is for only aspiration. Now it is connected to the electricity and switched on, and front panel switch is also on. Now we can adjust the cutting rate. It can go up to 900 cut rates. And we also can adjust the vacuum by pressing on the foot pedal and rotating the knob. In this machine, we can set up to 650 vacuum. To check the cutter whether it is working or not, put it into a bowl containing BSS. First aspiration, press on the push pedal. You can see the BSS getting aspirated and it is getting collected into the vacuum bottle. To check the cutter, you have to see the tip of the cutter. It will be oscillating to and fro. That means it is cutting correctly. Most common one is when you are priming, the cutter is oscillating, but when you are actually cutting the vitreous, it is not cutting. Probably cutter may be old and it has lost its efficiency, or the cutter sharpness is reduced. The solution is you have to change the cutter. If the probe is connected other way, air bubble will come out. Now everything has been connected, the vacuum is not generating. So you have to recheck again. Probably the tip of the vacuum bottle is loosely capped. So you have to tighten the cap and check again. Now the vacuum is slowly building up. So if you connect the vitrectomy tubes loosely, when you press on the push pedal, it will suddenly. Sometimes the vacuum won't generate. When you look at the vitrector, the tubings looks fixed, but the tip may be flared up. That time, the small jugaad, what you can do is cut the tip with scissor and refix it. So now it will be snugly fixed and it would generate normal vacuum. Now, how to maintain the anti-vitrectomy machine after the usage? Every time after completion of the anti-vitrectomy, you reconnect the machine and take a bowl and put a BSS in there and put a probe inside and check cutting as well as aspiration. So that would aspirate the fluid and also releases any clog with the vitreous, viscoelastic or any cortical material. And also you should see the flow, free flow of the BSS in the tubings. That would ensure that any clogging has been cleared. Flush the cutter with BSS just to doubly ensure that there is no clogging in the cutter. The tubing is dried with the help of air compressor. Before packing, the tubing should be folded in a rounded fashion and apply a bandage. Then it is placed in a pouch. The sterilization is usually done by ETO because you have applied the sticker. When you are opening it, the tubings won't fall in an unsterile area, and also it will ensure not to damage the cutter. Thank you.
How much time will it take to set up this machine?
No, actually it takes around 10 minutes. Actually not in 10 minutes, but once you start using it, but within 4 or 5 minutes you can.
I think once you train your staff very well. I think you should not take more than 3-4 minutes to set it up, I guess.
And also you should not get for long for ideal.
Okay.
So every time, every week, you have to check the cutters.
A dry run. You should always have a dry run. Yes. I think timetable for dry run. Yes. If it is going to take time, I think you should always keep it ready and connect it and then do surgeries for this. Yes. That also. Thank you, sir.
Yes. And I think that was a good idea that you placed a sticker inside the pot so that the doesn't fall.
Wrapping with a sticker.
This we found out after our experience. What happens? The PCR and vitreous loss is a panic situation. So we ask for anti-vitrectomy. They usually they suddenly open it, sometimes it will fall on the
Unsterile area,
and sometimes it will fall on the unsterile. Then what you make is you put on sticker there. You fold it roundly and put a sticker. So even if they remove it faster, it will fall on the.
I think these standalone vitrectomy cutters, there are two types: inbuilt compressor and what you showed was additional compressor, which is around.
Yeah.
So it might be a good idea if you have multiple OTs, because like your, I think hospital is big one. So if you have an inbuilt compressor, you can move it around very quickly without.
Can you name one inbuilt compressor standalone vitrectomy?
Yeah.
One company name which has got an inbuilt compressor.
Oscar Vision has a inbuilt compressor.
Okay, fine. Thank
Costa Vision, is it?
you. Oscar.
Oscar Vision.